And the governor warned Kentucky's new coronavirus cases should be a wake-up call. As higher numbers of positive cases are reported, the public health commissioner worries this is the start of troubling growth. So exactly how much worse are our numbers now? LEX 18 political reporter Carolina Buchek has a look at that.
On March 6th, the coronavirus was confirmed for the first time in Kentucky. Since then, new cases have been reported almost every single day. And last Sunday, the number of new cases surged.
Our single most positive cases by far, 979 Kentuckians testing positive for COVID-19.
So how does Sunday's total compare to Kentucky's other coronavirus numbers? Well, here's a look at Kentucky's daily new cases since March 6th. Besides May 5th, Kentucky's highest numbers of new daily cases have happened since July 7th. And May 5th surge has an explanation. That was the day Kentucky reported results from the Green River Correctional Complex after every person there was tested. So just by looking at the chart, you can see July has had more new coronavirus cases than March, April, May, and June.
Here in Kentucky, our surge continues as well.
And the rolling 7-day average shows that rise happening. This data averages each day's cases over the past 7 days. So it essentially smooths out any uneven reporting, like case numbers from Sundays and Mondays, which tend to be lower due to less labs reporting on the weekends. So this data gives us a more realistic look at what's happening. And it shows that the rolling average has significantly gone up since July 4th.
This isn't just because of more tests. More people are testing positive. At this moment in time, we are in an escalation.
And Kentucky worries it's just the beginning of the surge. The state's public health commissioner says we're at the base of the escalation of the curve.
It's consistent with what we've seen last week, where our numbers clearly broke out of a multi-month stable period.
Dr. Stack says there's no need for panic, but there is need for action.
Sunday is a warning. It's a shot across the bow. If we don't intervene, then we're going to see the fate here in Kentucky that they're seeing in some of these other states.
So that's why Kentucky took a few new steps, including a travel advisory for states that have a 15% or higher positive testing rate. Anyone who travels to one of those states is recommended to quarantine for 14 days.
If we don't take some strong action, people will see just how bad it can get in Kentucky, and just please believe me on this, we don't want to go there.
In Frankfort, Carolina Buchek, LEX 18 News.